Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Lorie Roffelsen, RD. Lorie Roffelsen is a registered dietitian at Washington Hospital Healthcare System. Lorie completed her studies at San Francisco State University. She is a prominent speaker for Washington Hospital's community outreach educational programs.
Hi, good evening, and Happy New Year. So this is our first Diabetes Matters for 2012. And this is a topic we covered about, I believe it was in 2009, and it was pretty popular at that time as well because I think people are always interested in additional things they can be adding to their current routine that might improve their health and their well-being. So the topic tonight is diabetes and dietary supplements, and what you should know about complementary and or alternative therapies for diabetes management. So what we're going to talk about is we're going to compare conventional or traditional therapies for taking care of your diabetes with alternative therapies. Define what a dietary supplement is. Discuss select supplements and their proposed effect on diabetes. So we'll try to just stay with the supplements that are related to diabetes or have some proposed benefit for diabetes. Discuss how to evaluate if a supplement is right for you. And I'm going to give you some resources for dietary supplement use, websites, and ways to evaluate if a supplement is right for you. So what are conventional or traditional therapies to manage your diabetes? Well, one of them would be prescribed medications. Some of you that have diabetes may be managing your diabetes without medication. Sometimes over time, as your diabetes may change, you may have to add in medication that you previously didn't have. Some are on combinations of medications or insulin and pills, so everyone's a little bit different. But that's one traditional therapy for diabetes management. The other cornerstone is healthy eating, or what we eat, and hopefully we're trying to eat healthy most of the time. And having a good understanding of foods and how different foods affect our blood sugars, understanding what foods raise our blood sugar, and what portions of those foods we can usually eat and still keep our blood sugar in a good range after we eat. Another important part of diabetes management is exercise and activity, because we know that walking and activity can naturally help us utilize the food that we eat more, get that glucose out of the bloodstream, make us more sensitive to the insulin in our body, help us with weight management. And then the fourth cornerstone is monitoring, because that's the feedback we need to know if all the other things we're doing are working for us. And monitoring can be what you're doing at home with a meter, can also be what the doctor does in the office, maybe every 3 months, checking your A1C, checking your lipid levels, checking your blood pressure control. All of those things are monitoring that give us feedback and let us know if we need to adjust or change anything that we're currently doing. So why are people interested in maybe additional things? Well, maybe they're doing all of these parts. They're taking their medication, trying to exercise, checking their blood sugar, trying to eat healthy, and their diabetes control maybe still not quite where they would like it to be. And I think that might be why some people are interested or look at other things that they can be doing. There's a whole field of different practices called complementary and alternative medicine therapies, and the acronym for that is CAM. If it's a complementary therapy, it is something that is added to your conventional therapy to assist in managing a disease. If it's something that's an alternative therapy, that is something that would replace conventional medicine or treatment. So for example, if you heard from a friend that garlic lowered your blood sugar and you decided to stop taking your glipizide or what other diabetes pill you're on, and just took your garlic pills that you bought over the counter, that would be making a decision to choose an alternative therapy over something that's proven, and would not be recommended to do that. But that's just an example of an alternative therapy. Integrative medicine combines treatments from both conventional medicine and CAM. And we do see that sometimes. So complementary and alternative medicine therapies for diabetes can include MindBody Medicine. So there's a whole domain of CAM that includes, this would include yoga, prayer, meditation, mental healing, and acupuncture. And there's a lot of belief that it helps with relieving stress, maybe relieving pain, relieving blood pressure. And so there's people who try to incorporate those types of CAM therapies. Another domain or field is natural products, which would include what we're going to talk about tonight: dietary supplements, herbal medicines and botanicals, vitamins, minerals, probiotics. They all fall under natural products. There's another domain called manipulative and body-based practices. And this would include spinal, chiropractic therapies, osteopathic manipulation, and massage therapy. And then what also falls under CAM are whole medical systems. The Far East has Ayurvedic medicine. Traditional Chinese medicine falls under CAM. And then there's a smaller practice of energy medicine, which is, and I don't know very much about this, bioelectric magnetic-based therapies that include magnet therapy, and light therapy. So some have more evidence and proof behind their efficacy, and others are therapies that have been around for a long time, maybe have some folk belief or just sort of traditional belief that they have some benefit. But we know there's an interest in alternative and complementary medicine. A lot of the therapies we talked about on the prior slide are not covered by insurance. And so these are therapies people are paying out of pocket for. Most dietary supplements are probably paid for out of pocket. And it's estimated Americans spent almost $34 billion in out-of-pocket money for complementary and alternative medicine. 2/3 of that was spent on products like dietary supplements, classes, and materials. And the other third was spent on CAM practitioners like acupuncturists or chiropractors. And among U.S. citizens, about 38% of adults, or 4 in 10 Americans, and 12% of children, or 1 in 9, have used some form of complementary medicine. I believe for children that refers to maybe the use of echinacea for colds. So that's maybe where kids have used CAM. But if any of you have taken a yoga class or have prayer in your life or use meditation, that all technically falls under CAM. So you may be using some of these therapies without even realizing it's considered complementary and alternative. But an interesting statistic I came across was that people with diabetes are 1.6 times more likely to use a CAM therapy than people without diabetes. So it's good we're talking about this tonight. Now, if you're interested in learning more about some of those complementary and alternative medicines, there is a website. It's federally funded, so it's a reputable website you can go to. It's nccam.nih.gov, and it's the National Center for Complementary and Alternative Medicine, or NCAM. And if you go there, they have information on all those different domains, on MindBody Medicine, on acupuncture, on yoga, on dietary supplements, anything that falls under CAM. And they will also talk about, if you are interested in looking at the dietary supplements listed there, which ones have some clinical trials or some evidence-based research behind their use. They also have a free electronic newsletter which you can subscribe to, and it's called NCAM Clinical Digest, and it's a monthly newsletter, and I gave you the link at the bottom of this screen, and they offer evidence-based information on CAM, give you up-to-date summaries of research and fact sheets, and they also have an archive of back newsletters, and the one in November was for diabetes. So if you go back, it actually looks like this if you print out the whole newsletter. So it's several pages. And it has, the nice thing is it also has at the back resources and also sources for all the studies that they talk about. So you can see where they got their information. And I looked to see what are they currently researching at NCAM that is related to diabetes. And they are researching chromium on glucose control and vascular function. They're looking at yoga in people at risk for diabetes. And I'm assuming they think that the yoga may help prevent diabetes, but we'll see what the research says when it comes out. They're looking at ginkgo biloba extract on diabetes medicines, EGCG, which is a catechin in green tea, and its body's response to insulin. They are studying Reiki, which is an energy medicine, on diabetic neuropathy and heart function. And then they're looking at insulin and how it is affected by vitamin C, glucosamine, and dark chocolate. So those are all studies that are in progress. And if we do a follow-up to this class in a few years, we'll hopefully have some new information to share. But since tonight we're focusing on dietary supplements, I really don't know a lot about those other domains of CAM. Let's start with what the definition of a dietary supplement is. The FDA defines it as a product other than tobacco that is intended to supplement the diet. So it's not intended to replace anything in the diet, but supplement only. It contains one or more dietary ingredients. It could be herb, botanical, vitamin, mineral, amino acid, etc. It's intended to be taken by mouth as a pill, capsule, a tablet, or a liquid. And it's labeled on the front panel as being a dietary supplement. So all of those things are required. There are some foods that kind of cross over. They're not dietary supplements, but they're considered kind of a new word, nutraceuticals. And an example is, it's a combination of a food with some pharmaceutical benefit. So when we add like probiotics, the good bacteria, to yogurt, that's considered a nutraceutical food. And then we have functional foods, foods that we know have some benefit for top health and wellness issues like lowering cholesterol. And so when you see a claim on a product that says oat fiber reduces cholesterol, that would be a functional food. So you know, your Cheerios also have some cholesterol lowering benefit. So how do prescription drugs differ from dietary supplements? Well, they're both under the umbrella of the FDA, but a prescription drug goes through a much more rigorous and long approval process by the FDA. Prescription drugs are tested for safety, for efficacy, so they have to do what the claim is that it does. A specific or safe dose amount is determined before it goes on the market, and the health benefits of that drug have to outweigh any risks. So you know, if you see drug commercials on TV, they always mention the risks. So there's always side effects to drugs that have some health benefit. As long as those health benefits outweigh those risks, then it's approved and allowed on the market. Dietary supplements, because they're under a different ruling, can be marketed without proof of safety or efficacy. So they can be put on the market before they've shown that they do what they claim to do. And they may or may not have evidence-based studies and research behind their claims. Now, the FDA does have the power to take dietary supplements off the market, but usually it has to be after there's an adverse, event, complaints, deaths sometimes. Those sort of things happen, and then the FDA can take action. But dietary supplements are required to have good manufacturing practices as far as cleanliness and other manufacturing practices as they're processed. So just keep in mind, if you're considering a dietary supplement, to ask what is in the bottle. Consider there could be potential drug interactions between that dietary supplement and prescribed or other over-the-counter drugs that you're taking. Just because it's natural does not mean it doesn't have risks with it. There's a lot of plants out in nature that are poisonous, and so we know that plants can be natural but can also be dangerous. They may have side effects, and depending on where it's made and manufactured, there can be variability in the composition of the product. There may be a lack of product standardization, meaning one bottle you buy might be more potent than the next bottle that you buy. And depending on where it comes from, if it's from another country, there's more risk for contamination or product misidentification, which has happened where people take a supplement thinking it's one thing, and it's tested and actually contains other ingredients. So those are things to consider. Also ask yourself before you take it, why do I want to take that supplement? What benefit are you hoping to see? Make sure you have a clear idea. Sometimes we can be, kind of encouraged or persuaded by other people we talk to that maybe are taking a supplement. Think about it, if it's really something right for you. So do your research on the efficacy of the health claim. Discuss with your healthcare providers. Ask your pharmacist if it's going to interact possibly with other medications you're taking. If you are seeing a dietitian or a nurse educator, any of those people would be good to talk to about it. Use available resources to help choose a reliable brand and source, and I'm going to give you some of those resources. And it's also a good idea, if you are going to take a dietary supplement, to set a time frame for taking it. Say, I'm going to try it for 3 months. I'm going to monitor my blood sugars. I'm going to see if I get any benefit out of taking that supplement. And if you don't, then you should, save your money and stop taking it. So think about, setting a time frame if you do add a supplement. The other suggestion is only add one supplement at a time, because if you have a bad reaction or a good outcome, if if you've added 2 supplements, you don't know which one was the problem or which one helped you. So just stick with one at a time. Now we're going to talk about some of the diabetes supplements that have some clinical trials behind them, that have looked at safety, looked at effectiveness, and safe dosages. The first one, alpha lipoic acid, it's also called lipoic acid or thioctic acid. It's a vitamin-like compound that's synthesized in the liver. It's a powerful antioxidant. It acts similar to B vitamins in the body. Typical dosing you might see is 600 to 1200 milligrams a day. It is found in foods in small amounts, but it's not very bioavailable, meaning your body can't really utilize it that much from food. And for the levels that they used in studies, you would have to use a supplement to get those levels. The diabetes-related claim is that it can help lower your blood sugar and may treat symptoms of neuropathy. Not that it cures neuropathy, but it may decrease the symptoms of neuropathy. And it does act as an antioxidant. So there is some evidence-based research behind alpha lipoic acid, but they are short-term studies. And again, the levels used in the studies are only obtainable from supplements or synthetic sources. So keep in mind potential side effects are hypoglycemia, and if you're on thyroid medication, it may interact with your thyroid medicine. So you need to discuss that with your doctor if you're on thyroid medicine. Another dietary supplement of interest is chromium. It's an essential trace mineral needed for glucose metabolism in the body. And typical dosing is 400, 800 micrograms a day in the form of chromium picolinate. It's also found in foods in trace amounts, red meat like beef, whole grain products, broccoli, grape juice, brewer's yeast, dried garlic, dried basil, and red wine are all food sources. The diabetes-related claim is that it can enhance the action of insulin in the body. There are some potential risks with excessively high doses. There's reports of kidney and liver failure or problems, blood disorders, mood changes. It can interact with many cardiac medications. And there's also a risk for hypoglycemia or low blood sugar reaction if you take chromium and insulin or other diabetes medications that increase insulin secretion in the body. What the evidence says is that it can work. Overall, the value of chromium supplementation for people with diabetes is inconclusive and controversial. They believe it's more helpful in individuals who maybe have a chromium deficiency, and it did improve their A1C and their glucose levels. But for people who have normal levels, it may not really be beneficial. And you can see the adequate intake for chromium is actually very low compared to those supplement levels that we talked about. The FDA also made a statement. One small study suggests that chromium picolinate may reduce the risk of insulin resistance and therefore possibly may reduce the risk of type 2 diabetes. The FDA concludes, however, that the existence of such a relationship between chromium and either insulin resistance or type 2 diabetes is highly uncertain. So they're not even saying it reduces the risk for type 2 diabetes. Now, there is more evidence for omega-3 fatty acids. There's a lot of studies, mainly looking at the benefits for preventing sudden cardiac death, reducing inflammation, and having diabetes does raise your risk for heart disease. So definitely omega-3 fats, many of you might be on them, fish oils of some sort, or just trying to include foods in your diet that are sources. my next slide actually has a list of all the food sources. So there is a lot of evidence-based research to include omega-3 fats as a dietary supplement. There isn't evidence that it reduces insulin resistance or blood sugar. Again, it's more for reducing inflammation and risk for sudden cardiac death. Because of fish oil supplementation, if it's at high levels, can have a blood thinning property, they're not necessarily right for everyone. So if you're thinking of adding them to your routine, check with your healthcare provider. But good food sources that you can include, like the Heart Association says have 2 fish meals per week. And the fish listed here, anchovy, herring, mackerel, Atlantic salmon, lake trout, halibut, and Pacific oyster are all good sources of omega-3 fats. The plant version, the alpha-linolenic, is not studied as much. There isn't as much evidence for that type of omega-3 fat as having the cardiac benefits as of the fish type, the EPA and DHA. But there are also benefits to the plant type. So also include your green leafy vegetables. Flaxseed is the best source of the alpha-linolenic acid. You can also get it from soybean oil, black walnuts, wheat germ oil. Now the fourth supplement we were going to talk about was polyphenols, which are prevalent in like green tea. The active ingredient is the EGCG, or the T catechins, which are an antioxidant. One study looked at green tea consumption and saw an inverse relationship between people who habitually drank tea and they had lower body fat and waist circumference. And so it's believed that it may improve insulin secretion from the pancreas. So those that drank more tea had less abdominal fat and overall body fat. So there is evidence-based research for green tea benefits. Is it recommended for everyone for diabetes management? Well, if you can tolerate caffeine, because to get the levels in these studies, you'd be drinking like 4 to 6 cups a day of green tea, which has caffeine. So if you have issues with insomnia or anxiety or blood pressure, you may not be right for you to include that much green tea. Also, green tea has vitamin K in it, which is a blood thinner. It can counteract the effect of blood thinners like Coumadin. So if you take large amounts of green tea, it may decrease the effectiveness of a blood thinner if you're on Coumadin. Okay, another popular dietary supplement is fenugreek. Fenugreek is a plant, it's cultivated worldwide. It's used both for its leaves and its seeds, and it's used widely in cooking by many cultures. The diabetes-related claim is that it may help lower blood sugar levels by stimulating the release of insulin. There is evidence-based research that it's effective, but there are very few and small studies. And I don't know if this one is as, widely being studied as some of the other ones we've already talked about. So there may not be more studies to report on later. The source in the studies, they consumed it either as a seed or as an extract, and it is also available in a capsule form and as a tea. The typical dosing, it kind of ranges from 5 to up to 100 grams a day. So that's a wide range for dosing. Probably with the higher doses, you might see gastrointestinal distress. It can interact with blood thinning medications. And it's not recommended in pregnancy as it can cause uterine contractions. It may also cause hypoglycemia by enhancing the effect of other diabetes medications you might be on. So those are all cautions with fenugreek. Cinnamon is another popular botanical that's been studied for its medicinal uses. The variety that was studied is Cinnamon cassia. It comes from the bark of trees native to China, India, and Southeast Asia. And they take the bark to make powders, capsules, teas, and liquid extracts. Folk medicine, it's been used since ancient times for treatment of bronchitis, gastrointestinal complaints, for loss of appetite. The diabetes-related claim is that it decreases insulin resistance and increases glucose uptake into cells. But the science says, and this is a summary from NCAM, they say an analysis of 5 clinical trials concluded that cinnamon does not appear to affect factors related to diabetes and heart disease. So supplementation of cinnamon, the studies don't support its use or effectiveness for diabetes or heart disease. You certainly can cook with it and add it in your diet in that way. Because it was studied in some clinical trials, they can say it appears to be safe for most people when taken by mouth in amounts up to 6 grams daily for 6 weeks or less. So those were short clinical trials that looked at it. Some people may have allergic reactions to cinnamon or its parts. And another caution, cassia cinnamon, so if you are looking at a supplement of cinnamon, see what variety of cinnamon it is, because cassia cinnamon contains coumarin, which is the parent compound of warfarin, which is a blood thinner. If you are taking warfarin and then you take a cinnamon cassia supplement, you may further thin your blood. So it's just interesting. A lot of these botanicals do have blood thinning properties. So if you are on a blood thinner, really, research that before you add something like that to your plan. Another plant of interest is Asian ginseng. And that's kind of, again, one of those that's being in the process of being studied. It's an herb, and they take the root and they dry it, excuse me, and they use the root to make capsules, tablets, and extracts. The diabetes-related claim is that it may lower your blood glucose. There are evidence-based research studies that say, yeah, it may lower blood glucose. It's currently not recommended by NCAM. They support further research into the safety and potential uses of Asian ginseng. So what they might be doing right now is looking at what are safe doses that could be recommended if you wanted to use this. Another plant, milk thistle. It's a flowering herb. The diabetes claim is that it lowers insulin resistance, lowers cholesterol, and improves liver function, but all the studies do not have conclusive agreement on those claims, so it is not recommended at this time. I included Hoodia because it has, this is another plant. It's marketed as an appetite suppressant for weight loss. It doesn't have evidence-based research behind it, though, and so it is not recommended for diabetes management. Another plant you may have heard of is turmeric. It's a shrub that's similar to ginger. It's used in cooking. It's used throughout India, Asia, Africa. It's used in fabric dyes. It's also used in curry powders, mustards, and cheese. The diabetes-related claim is that it reduces inflammation. There's not enough evidence-based research to recommend its use as a supplement, but certainly you could cook with it and include it in your diet in that way. Researchers are looking at aloe vera. The aloe is the clear gel inside the leaves. It can be used topically or taken orally. This is another plant that's been used for hundreds of years, and the health claims are that it works as a laxative. You can use it to treat burns, skin conditions, diabetes, epilepsy, osteoarthritis, and asthma. People with diabetes who use glucose-lowering medication should be cautious if taking aloe by mouth, because preliminary studies suggest that aloe may lower blood glucose levels. So this would be one of those that you would, any of these that you might be interested in that have the potential to lower blood glucose should kind of send up a red flag that you should be monitoring your blood sugars more often if you want to try one of those. There are some other botanicals of interest: prickly pear cactus, gurmar, Coccinea indica, Chinese foxglove, and bitter melon, which have some studies behind them, not real good clinical trials. They're also looking at magnesium and coenzyme Q. And there's probably some dietary supplements out there that you've heard of or are interested in that I haven't covered, and you'll probably stump me with one when we get to our questions. But there are many out there, and that's why I'm going to give you some resources to do some of the checking on your own if something comes up that we haven't discussed. First of all, if you're searching the internet for information, if you just Google the name of a supplement, you will get all kinds of websites. Look at the website and ask some questions. Who operates the site? Is it a company that is trying to sell a supplement? So what is the purpose of the site? What is the source of the information, and does it have references to the claims that it's making? Is the information current? And does the claim sound too good to be true? If the claim on the website is that this supplement's been curing 5 different diseases for hundreds of years, it's probably not true. So try to, you may want to believe that it's true, but you have to, be skeptical. So these are suggestions from the FDA. Ask these questions when you are evaluating a website. At the end of the talk, I am giving you a list of resources for reputable websites where you can go and get information on supplements. There is also a couple agencies that do testing of products. So if you have decided to take a dietary supplement, but you're not sure what brand to purchase, there is United States Pharmacopoeia, which is a not-for-profit, non-governmental agency. It sets quality standards for dietary supplements, and they follow the standards set by the FDA. They offer a voluntary program where manufacturers' supplements are tested for quality, and they confirm the quality of the ingredients as well as good manufacturing processes by that company. So to earn this USP seal that you would see on the bottle, the product is tested, and they verify it contains the ingredients listed on the label in the declared potency and amount. It does not contain harmful levels of specified contaminants. It will, they test it to make sure it breaks down and it's released into the body in a specified amount of time. Because you wouldn't want to take a supplement that doesn't get digested and broken down and utilized, right? And they also verify that it's made according to FDA good manufacturing processes. So I listed their website, usp.org. You can go to that website, and they list all the manufacturers. These are some of them that have their seal. And you could click on, let's say you click on the Kirkland brand. It'll list all the supplements by Kirkland that they have tested and approved. And then they also list on the website stores where you can buy their products, like Walgreens or Costco or Safeway or you know, all the various stores where you could go purchase them. Another option is Consumer Lab. They also have a website. They also do testing of products. They have a database, but you have to subscribe to it. So there's a little bit of a monthly fee to have a subscription, but that allows you to get into basically their database of more information. And so they also test dietary supplements for quality and for, you know, that it contains what the label says it contains. So some key points to keep in mind with supplements is, in general, there is not enough scientific evidence to prove that dietary supplements have substantial benefits for type 2 diabetes or its complications. It's important not to replace conventional medical therapy for diabetes with an unproven CAM therapy. And tell all your healthcare providers about any complementary and alternative approaches that you use. Give them a full picture of what you do to manage your diabetes. And this will help ensure that you get coordinated and safe care. And here are some of the reputable websites where I urge you to go to. The NIH. Specifically for herbal supplements, you can go to the FDA as well as NCAM. And between those two sites, you can get information on probably most dietary supplements that are out there. At the FDA website, they also will list if there's warnings or adverse reactions to any particular supplement. Those would be listed at the FDA website. And one of the handouts at the back, also on dietary supplements, has on the back side phone numbers for the FDA. So if you have an adverse event or reaction to a supplement, or if you have a complaint, you can contact the FDA to let them know about that problem. Thank you for coming.